So, just in time to crash your summer plans, cases of COVID are on the rise across the U.S. as a new variant spreads. Although individual cases are no longer being counted, the CDC says that infections are growing or likely growing in 43 states. And this comes as the agency just last week recommended that everyone 6 months and older should get an updated vaccine. So for more on the summer surge, I want to bring in Dr. William Schaffner. He's a professor of medicine in the Division of Infectious Diseases at Vanderbilt University School of Medicine. Good to see you again, doctor. So what's going on? Where are we seeing, possible rise in COVID cases in the U.S.?
Well, good morning, Emery. Yes, summer is back, and we're about to have the summer bump that we call it, of COVID cases. We have a bump in the summer, and then it goes down in the fall and goes up more substantially in the winter. So we are seeing an increase across the United States of infections. These new COVID variants, they're grandchildren of Omicron, the most common variant, are very, very contagious. Now, virtually all of us have had some experience with COVID in the past, whether through infection or vaccination or both. So what we call our population immunity is much better. So there are fewer severe diseases. That said, I will emphasize, as I always do, those people who, should they get COVID, are at increased risk of serious disease. Older persons, people age 65 and older, people with underlying chronic medical conditions, diabetes, heart disease, kidney disease, any other chronic illnesses, persons who are pregnant, and of course, people who are immune compromised. They should take precautions. If you're traveling, going indoors to group activities, dust off that mask.
Right.
Put it on. That'll help you.
Yeah, I was just thinking about how basically everything that we learned about communicable diseases, we just kind of have thrown out the window. It's not that we're not wearing masks anymore, yeah, for sure, but we're eating out of communal bowls. I mean, we were just right back to where we were before. I mean, there must be a concern that, yes, there's a summer surge, but particularly after the 4th of July, because during the COVID time, after particular moments when people would gather, we would definitely, like 2 weeks later, see a bump.
Yes, for sure. And there's an awful lot of vacation travel that's going on today. The airlines are full of people. So if you're traveling, please put on that mask. And this applies particularly to people who are in those high-risk groups. We want to protect them as much as possible.
So I have to admit, I haven't had a vaccine in a while. I mean, since the last kind of go around of bumper shots. Do you suggest that people maybe, get that vaccine if they haven't in a while?
Well, we should have received the vaccine last fall. We get an updated vaccine each fall, and the CDC has recommended that we all do that again this fall. But if you are in a high-risk group, particularly if you're immune compromised, even though you received vaccine in the fall, you can get another one now to carry you through the summer until it's time in October, November to get that updated annual vaccine that will be available then.
This is coming at a time, sort of an odd time where we're seeing these like anti-mask laws, making it illegal to wear a mask in certain places. And it has to do with protests and sort of having to be able to identify people. If you're talking to people who are concerned, maybe they're in New York and they're traveling the subway and they're, contemplating banning masks on the subway, but you're vulnerable, what do you say to those patients?
This is entirely voluntary. We're not talking about mandates. This is a matter of personal protection. And so if you're in a high-risk group, I'm in a high-risk group, see? Gray hair. So when I go to the supermarket, I put on my mask.
Right.
And if I want to travel, I would use the mask the same.
All right. Dr. William Schaffner, thank you so much.